This was a very challenging and difficult case for me. This was a young woman who came to our practice for prenatal care, healthy, and we watched her all the way through her pregnancy, and then around 39 weeks of gestation, we needed to induce this patient because there were some problems with the baby's growth. The patient came in for induction of labor at 39 weeks, and it was a long induction because the cervix was not particularly ripe. So it took about 2 days for this patient to become completely dilated, and then she had to push. She pushed for approximately 2 to 3 hours, and then it was obvious that she was pretty exhausted. So I assisted delivery with a vacuum extractor, and the vacuum was placed on the fetal head, and it's a pretty safe instrument because if it pops off, that's a fail-safe mechanism that too much pressure has been placed on the fetal head. So after the vacuum popped off, I told the patient that she needed to have cesarean section, and she declined.
The claim filed against Dr. Nye, in a general sense, was a failure to timely deliver a baby, leading to brain injury and neonatal death. More specifically, it had to do with the doctor's decision to use a vacuum, and after the vacuum failed, the claim was that the doctor should have immediately moved to a cesarean section delivery. That was the recommendation of the doctor, and she charted it. The patient declined. Plaintiffs maintained that had this baby been delivered, as they claimed much earlier, there would have been absolutely no injury and certainly no fetal death.
I felt really scared and gloom and doom, and then I kept thinking about what could I have done better, what should I have done differently, was there something that I had missed? I couldn't sleep, I couldn't eat, and it was very, very difficult for me to hold my head up and feel good about myself.
Our feelings about the case were that it was one that we would and should defend to verdict. At the same time, the facts let us understand that this was going to be a very difficult case. It had all the emotional components that are present in cases against obstetricians where there's been a neonatal injury, or in this case, both a neonatal injury and death.
The Doctors Company provides the attorneys the resources they need in order to prevail on a case, such as flying the necessary expert witnesses from around the country or overseas to enhance our case. In the end, it takes a team effort from the doctor, the attorney, and the claims specialist to have a successful result.
Dr. Nye worked very closely with her entire defense team from the very beginning of this lawsuit all the way through until verdict. She was instrumental in helping us identify the witnesses that we would want to depose and ultimately call at trial. She was familiar with the nurses and the doctors. Most important to the outcome of this case, however, was Dr. Nye's willingness to work with us to prepare herself for both her deposition testimony and her trial testimony. And I can say without hesitation that it was her testimony, her credibility, that won the case, because she needed to convince this jury that she in fact gave the patient advice to have a cesarean section, that the patient rejected it. Though there was a great deal of sympathy in this case for the plaintiff, they had shown a video of the mother withdrawing life support from her infant daughter and the baby passing away. And even though after the verdict the jurors came out and hugged and cried with the mother who had lost her baby, they still did the right thing and found in favor of Dr. Nye.